Are boxers prone to heart conditions? Boxers are known for their fierce determination, strength, and agility inside the ring. However, behind their burly physiques lies a vulnerability that many might not be aware of: their susceptibility to heart conditions. While some may be quick to assume that a boxer's rigorous training regime and intense physical demands are the culprits, there are various factors to consider when exploring this issue. To accurately evaluate whether boxers are prone to heart conditions, it is crucial to understand the sport's physiological impact on the cardiovascular system. Boxing pushes the body to its limits, demanding high levels of cardiovascular endurance. Boxers engage in intense training sessions that include cardiovascular exercises like running, skipping, and heavy bag work to promote stamina and improve overall performance. Despite the positive effects of cardiovascular training, the repetitive nature of these activities can have adverse consequences for the heart. Repeated exposure to high-intensity exercises without adequate recovery time can lead to the development of arrhythmias, cardiomegaly, enlarged heart, and, in serious cases, cardiovascular disease. The constant stress on the cardiovascular system can potentially disrupt the heart's normal functioning. Additionally, the weight-cutting practices prevalent in boxing pose a significant risk to a boxer's heart health. To fight in a particular weight class, competitors often employ various techniques to shed excess weight before weigh-ins. These methods include dieting, dehydration, and saunas, which can put immense strain on the body, including the heart. Dehydration, a common practice during weight cutting, can lead to decreased blood volume and thicker blood consistency. As a result, the heart has to work harder to pump blood throughout the body, putting additional stress on this vital organ. This increased workload heightens the risk of cardiac abnormalities, particularly in boxers who engage in frequent weight cuts. Furthermore, head trauma, a prevalent issue in boxing, can have indirect consequences on the heart. Repeated blows to the head, even with protective gear, can result in concussions and traumatic brain injuries. These injuries can lead to neuroendocrine dysfunction, including damage to the hypothalamus and pituitary glands, which regulate hormones involved in heart function. Studies have shown that traumatic brain injuries can disrupt the body's autonomic nervous system, leading to an imbalance in sympathetic and parasympathetic control. This imbalance can manifest as changes in heart rate, blood pressure, and cardiac output, potentially increasing the risk of heart conditions in boxers. While the sport of boxing undoubtedly has its inherent risks, it is essential to note that not all boxers will develop heart conditions. Genetics play a significant role in an individual's susceptibility to cardiac issues. Some athletes may have inherited traits that predispose them to heart abnormalities, regardless of their involvement in boxing. These genetic factors can influence heart structure, electrical signals, and the overall cardiovascular system, making certain individuals more prone to heart conditions in general. It is important to emphasize that the prevalence of heart conditions in boxers is not exclusive to the sport itself. Other factors such as lifestyle choices, pre-existing conditions, drug use, and overall health status can contribute significantly to the occurrence of heart-related issues. Therefore, it is crucial for boxers and athletes of all disciplines to prioritize their cardiovascular health and maintain a comprehensive and holistic approach to their well-being. To mitigate the risks associated with heart conditions in boxers, regular medical checkups and screenings are vital. Echocardiograms, electrocardiograms, and stress tests can help evaluate heart structure, electrical activity, and overall functioning. Identifying potential abnormalities at an early stage enables prompt intervention and preventive measures, safeguarding the long-term health of boxers. In conclusion, boxers do face an increased risk of heart conditions due to various factors associated with the sport. The intense cardiovascular demands, weight-cutting practices, head trauma, and genetic predispositions all contribute to this susceptibility. However, it is crucial to acknowledge that not all boxers will develop heart conditions, and lifestyle choices and overall health status also play a significant role. By prioritizing regular checkups and taking necessary precautions, boxers can minimize their risk and ensure their heart health remains a top priority alongside their athletic prowess.